Thank you so much, Jeremy. Yes, I'd like to welcome everyone today to Grief and Loss in Children and Youth with Dr. Melinda Kavanaugh. We are so happy and pleased to have her back again this month to share her expertise in this area. For 40 years, we have been working with individuals living with ALS, and we know that when someone in a family has ALS, it impacts the entire family system, including children. Despite the growing focus on persons living with ALS and their adult caregivers, children and youth remain the most hidden and least addressed in families with ALS, including discussions of grief, loss, and death. Many parents want to know, will my child be okay to grieve? What does grief look like in my child? Youth know things are changing, but they're not always sure what's changing and how it's changing. And again, this is a topic that Dr. Kavanaugh is an expert on. Before I formally introduce you to Dr. Kavanaugh, I would like to tell you a little bit about the foundation. We are leaders in comprehensive ALS care and research and realize that people living with ALS may feel overwhelmed and unsure of what questions to ask and what to do next. The Les Turner ALS Foundation exists to care for those affected by the disease, guide them to answers, support them and their loved ones, and provide hope through scientific research. Our support services team is comprised of knowledgeable and compassionate nurses and social workers with many years of experience guiding people and their families affected by ALS. We offer the following support services for people with ALS and their families, including care visits by ALS support services coordinators, support group meetings, education materials and programs, access to medical equipment and communication devices, and we offer need-based grant programs and community resources, as well as in-service education for community care. At our Lois and Salia ALS Clinic, we offer access to enrollment in clinical trials and dedicated clinical trial coordinators. We are Chicagoland's first and largest multidisciplinary ALS clinic with the highest number of neurologists and dedicated pulmonologists. We provide access to no-cost, coordinated support and expertise from ALS support services coordinators from the Les Turner ALS Foundation. And lastly, we offer multidisciplinary care that brings together an experienced team of neuromuscular specialists in one clinic to provide comprehensive support for you and your family. Again, I can't state it enough that we are really lucky to have Dr. Kavanaugh back with us again this month to really shift the topic away from talking with children about ALS to really focusing on how they grieve and experience loss and what that looks like in children. This is a topic that Dr. Kavanaugh has done extensive research on with hundreds of children. And she'll tell you a little bit more about that today. Dr. Kavanaugh is a licensed clinical social worker and associate professor, social work at the Helen School of Social Welfare, University of Wisconsin-Milwaukee. She is a leading expert in young carers and is the principal investigator for numerous research studies on families living with neurological disorders, including Huntington's disease and ALS. Working with the ALS Association chapters across the U.S., Dr. Kavanaugh developed an evidence-based intervention for young carers, Y-Care, a multidisciplinary youth caregiving skills and support protocol for youth in families with neurological disorders. She has presented her work both nationally and internationally and has written several books for children, young adults, and families living with ALS. It is my pleasure to introduce Dr. Kavanaugh.
Hello, thank you. Gosh, that's such a lovely, warm welcome. I certainly appreciate it, and it is absolutely my pleasure to be here with you all today. I'm just going to ask really quickly if everyone can see my screen. I'm not entirely sure that it's showing. So if you can't, please, Nicole or somebody let me know, but I hope it's being shown. So in light of that, thank you all for coming to what is often the absolute hardest topic to have. families and individuals and professionals, talking about death and dying is often the one thing that we all steer clear of, particularly when children and youth are involved in that discussion. And it's something I term as the hardest topic because we don't know how we feel. We don't know what to say. We feel like there's somehow the right thing to say and somehow there's the wrong thing to say. But what I want to be really, really clear at the beginning of this presentation, and I hope you all think about this throughout everything that I talk about today and throughout whatever it is or however much of it you take away, is that it's okay to be sad about this topic. It is absolutely okay to not want to talk about it. It's absolutely okay if you want to talk about it. And particularly, it's okay if you want to protect your child or keep your child from thinking about it. But it's also absolutely okay if you want to tell your child everything. So what you can see from this particular slide is that it's all okay. And I'm not here with final answers and the definitive on what you should say or not say, or what you should do or not do. I'm simply here to give you some guidance and very much needed support, because over the years, if there's one thing I have certainly learned from families, is that there's just not always enough support, particularly around the topic of grief and loss and death and dying and children. So I hope that you sit with this slide and recognize that whatever you feel is the way you feel, and it's absolutely okay. So I'm just going to jump right in. The guide that I use for this presentation is a book I wrote several years ago, and it's really based in my research with children and families living with ALS. It's based in my clinical expertise. I've been a licensed clinical social worker for many, many years, with most of those years in neurology. So if any of you are interested in getting a copy of this book, we can certainly facilitate that at the end of the call. But just so you know, a lot of what I'm talking about is really based in this book. So if it's something you want to make sure that you follow up on, or that you have additional information, please don't hesitate. Let us know and we'll make sure you have access to a copy. So one of the first questions I get is, should we talk about death and dying to our children and youth? And what we know is there are lots of people who've done some really impressive research on this. And we know that talking to your children, so we're talking about communication. And in the first webinar that I did several weeks ago, the one kind of take-home message was communicate, communicate, communicate. And it is exactly the same around death and dying. That talking to your children really helps them express their feelings, because what we know is that they're going to model some of their behaviors off of your behaviors. So if you model that openness and you talk with them and you allow them to express their feelings, then they're overall less anxious and less unsure. And it helps them process that loss, even in young children. And that the most important thing is that they have clear and accurate information, because we know that kids, children, youth, adults, older adults, everybody can access anything on the internet, anything. And we also know that children and youth want to hear about these most complicated, most emotional, and most difficult topics from their family, from their parents, from their grandparents. They want to hear it from the people that are going through it with them, and they want to hear it from the people who are personally experiencing it. So you as the parent, if there's parents on this call, if there's grandparents on this call, it's really important for children to be able to get that correct information from you so that they can express themselves in a way that they feel comfortable without any shame or stigma, which is something we see that is very much wrapped up in this conversation around death and dying. So when I have interviewed children and youth, I've asked them, I ask kids the most complicated and emotional questions. And I ask them, have you talked to your family member, your loved one, your parent, your grandparent? Have you asked them about, are they going to die from this disease? What do they think about it? How do you talk about it? And what I have found with the children and youth is that they say that they want to talk about it, but they're concerned because they feel like when they bring it up, it makes their parent feel uncomfortable. So see, that's an example of how the adult is modeling that awkwardness, because we as a society do a terrible job of talking about death and dying. But children pick up on that and they say, oh, it makes my mom or dad or whoever feel uncomfortable, so it kind of makes me feel uncomfortable. But they also say, I'm not going to bring it up unless they bring it up. I don't want to be the person to start the conversation. I want my family member to be the one to start the conversation. Because if you'll see, they say, I don't want to make her any sadder than she already is. So what we're seeing is that kids are taking on a lot of that ownership for the feelings around the death and the dying, or the grief and the loss. But when you ask them, tell me, how does it feel? They say, you know, it's kind of hard to describe it. I feel upset. I feel emotional. I know that my mom is going to die, like way before the average person. But dealing with it and knowing that she's getting worse and worse. So what we see is we have youth who are saying, I want to think about it, but I know my parent gets uncomfortable. I don't want to bring it up because I don't really know how I feel about it. I don't know how she feels about it, but the truth is I know it's going to happen. So I put this slide up here to hopefully start making you feel a little more comfortable, or a little more, okay, kids do need to talk about this. So when they think about it, they're saying, I want to talk about it. I don't want to make them uncomfortable. I'm not sure what it's going to look like. I'm sad. What are some of the real, true, hard and fast questions that kids have? And these are all honest, legitimate questions. They want to know what death looks like. And that might seem like a really dark question, but the truth is, children and youth don't really understand it, because many times kids have been told that someone goes away, and that's such a vague term that they don't understand. They want to know, so when mom or dad is getting ready to die, are they going to stay in the house? Am I going to be there? What's going to happen to me? What does a funeral look like? Right? They might have heard the word, but I don't know what a funeral means. So who's going to be there to help me? And then when my mom or my dad living with ALS dies, so where are we going to live? And for us as adults, you might think, well, that's a silly question. They're just going to live with their other parent. But we have to remember, we have to put ourselves in the minds of the children and say, if they've always known a family to be a mom and a dad, or a mom and a mom, or a grandma and a grandpa, or an aunt and a grandma, whatever that unit looks like, when one person is gone out of that unit, they don't automatically know where they will go. So it's something that as adults we can take for granted, but we have to remember that children don't think in the same way. So how do you respond to that? Now, I've had many parents tell me point blank, there is no way I'm going to respond to any of those kinds of questions. And I get that. And I want to remind you that there's no definitive answers. But I put this slide up there to kind of push a little bit to say they're not going to ask all those questions, but being prepared is critical. Think about how you might respond. Have you even thought about those questions? Some people don't want to think about what my death might look like. Do I want to die at home? Do I want to die in the hospital? Do I want to die in a hospice? Some people don't have that choice. Some people do. So it's something for us to think about. Again, a very difficult topic, but absolutely critical. So you can prepare and you can be honest, even if that means you're not sure or you're upset. And that leads to the third one, which is to tell them how you feel. And we talked about this a few weeks ago in the Talking About ALS webinar. When you are honest with your feelings and say, I'm not really sure, this is confusing to me and I want to figure this out, then that models to your children and your grandchildren that they can also be unsure, that they don't have to have the answers. But you're going to address it and you're going to let them know that, you know what, I'll get the answer. I'm not sure what the answer will be. I'm not sure exactly how I will feel about it, but we're going to get an answer and we're going to have a talk about it. And it's going to be difficult, but we as a family are going to address it, whatever your family looks like. And for a lot of you out there, family are your best friends. And that's perfectly fine. And it's about engaging who that family is, that we're going to have a conversation about it. We're going to be honest and we're going to acknowledge our feelings. Because when we as adults in the situation don't step up and say, I'm feeling kind of stressed or I'm feeling upset about it, we worry because we want to protect our children. And that's an absolutely natural kind of mama bear instinct, right? But in a topic like this and something so big, they're really, really, really roiling on the inside. I guarantee you that the children and the youth out there they're thinking about it, they're feeling it, and they need to know that they can talk and have that same emotion. So when people ask me, well, how do I talk to my kids? What about my little kids? What about my teenagers who are they don't want to talk to anybody about anything, much less death and dying. So the next few slides, I want to be really clear. These are simply suggestions because the truth is, you know your child, your grandchild, better than anybody. And the last thing I would ever want to do is say, if you have a 5-year-old, this is what you have to do. These are suggestions, and they're suggestions that are based in development, that are based in developmental theory, that are based in my clinical practice, but please take them as suggestions and always, always seek support from the Les Turner ALS Foundation, from your child's school, from friends, from family, from clergy. Whoever is a trusted source for you and your family, please, I can't encourage you enough. Dealing with a diagnosis like ALS is life-changing, life-altering, can change you for the better or for the worse. But when you're talking about the actual end of life, that's when reaching out to get support from others is so critical. So the first age group is really young. And it's interesting because I often get a little bit of pushback when I talk about it at this young age. But the truth is, these kids are seeing it and they're around and they understand it. And you need to be able to allow questions. Be honest and use simple terms and words. And if there's one thing I highly encourage you not to do, because it's easy to do, is to say that someone has gone away or that someone is just sleeping or that they've left, because these are abstract terms that young children like this who are very black and white thinkers don't understand. Now, they do understand when they have to go to sleep at night and they don't want to go to sleep. But if they go to sleep at night and you just told them that dad isn't here anymore because he's sleeping, that's going to be confusing for them. So as hard as it is, think about just saying that Daddy died. And what that means is he's not personally here anymore. He's always in our hearts. He's always with us, around us, because we love him and we feel him. But he as a person is not here anymore. And that is very confusing. But you are there, or whoever you are, grandparent, parent, aunt, uncle, friend, you're there. So reiterate that you're there. There's a normal schedule. There's a normal structure. These, children this age need to have those boundaries and those structures. And also to be really clear that death is not contagious, which is something as adults we might go, that's kind of crazy. But children this age, they don't understand hypotheticals. They don't understand that really complex abstract thought. So they might just think, oh, if he died, I will die. If she died, mom will die, right? So these are very concrete thinkers, and you have to have those concrete conversations with them. As your children get a little bit older, they might be thinking about deeper questions, right? Did I do something to make my father, my grandfather, my uncle, did I do something to make them die? So this is where you're reassuring them, this is not your fault, that they did nothing wrong. And this is a really good age to get them to be creative, to play, to get an outlet for their emotions through art and through therapy, and continuing to be as honest and compassionate as you possibly can. When you get into this age group, this is the age group that is often defined by building their identity. Who are they, right? Starting to really recognize that they need to be like their peers, or they need to not stand out and be that really different kid, that they're a little bit more like, okay, this is what peers are like. That they don't have to be just like what they think everybody else would do, right? That they don't have to necessarily be brave, that they don't have to suck it in, that they can express themselves. This is an age group where you always are wanting to check in about their feelings and about their expression. They might be acting out. You might actually see acting out from a very young age, but you don't want to punish for that acting out, but encourage them and ask them and really communicate and engage them that it's okay to feel the way they feel, that they don't have to be brave and keep it sucked up, and they don't have to act like they're other friends if they're not upset about something, even if they don't know anybody who even has a family member with ALS, right? So this is also a really good age to have them think about how they can be a part of the process. And this might be the memorial service. This might be whatever celebration of life, whatever you may or may not have planned. This is a really good age to get the kids engaged and involved in that. And lastly, into adolescence. So sometimes you get some adolescents who absolutely want to be their own person. They're trying to differentiate from the family. They're trying to, they've certainly identified with their peers, but they're trying to do their own thing. But they don't have to take over that kind of adult role to manage the family, which some adolescents absolutely want to step into. You want to encourage them to talk, even when you might have a teenager who just wants to be in their room playing Fortnite all day. Encourage them to have conversations, to be honest, and to express themselves. But again, they don't have to take over the role of the adult in the family because mom or dad or other parent or grandparent just died, right? Really, really encourage peer support. Peer support is so critical at this age. And whether it's through the Les Turner ALS Foundation, whether it's through your school, whether it's through whoever it is, find peers, like peers, and there are many, many, many grief and loss organizations that aren't necessarily ALS specific, but really help teenagers deal with grief. And that's a huge takeaway that I hope if you have a teenager that you can look into and find some support. The thing that's really, really helpful across ages is to put together, you know, people do, so many organizations do this, so many hospitals, clinics, hospices, this idea of a memory box or some sort of art or activity is brilliant. It is not at all my idea. People have been doing this for years, but just think about how might you be able to put something together if you are the person living with ALS and you want your child, grandchild, nephew, niece to really remember some beautiful memories? Can you create memories together? Can you write letters to them that they'll have throughout their life, whether at big moments in their life or just random times that they can read a letter? Can you do it together? What is it that's really going to capture you and your relationship with the child that they can go back to and really hold on and remember by? So this idea is brilliant, and I highly encourage you to think outside the box of any kind of thing you can do to kind of hold on to some of those beautiful memories. And this is an example of a young girl at a group I was running, and she created her family with ALS out of Play-Doh. So we talked about the death and kind of how you think about that by age group, that it's okay to talk about it. You don't need to shy away from it. But when someone dies, we experience grief. And it's a loss, and it can be very emotional, it can be very sad, but the thing to remember is that grief is natural. Grief is normal, even for kids, and it is absolutely okay. And there are lots of things that can bring on grief. And so what I'd like you to think about is that grief is associated with loss. And what we know is that loss is definitely the death. That person is no longer physically here. But there's losses that happen often incrementally along the way that can spark that grief, that emotion, and that sadness. And these are especially profound in families with ALS because of the way ALS can change function and change what we consider the normalcy of a family, whoever that family is and whoever's made up of that family. But that normalcy is disrupted when a parent or a grandparent can no longer go for long walks with your child, can no longer ride a bike with them. So we think about it in terms of those kind of incremental losses. Every time a new symptom or a progression of a current symptom, the person with ALS is, oh, okay, all right. So this has changed, right? So, you know, this is a new thing, and we're soldiering through, and we're creating our new normal on a daily basis. But what we need to know is that for the child, they might be seeing those things as losses. Even though we as adults are saying, you know what, we're creating a new normal. We're going to get a big wheelchair with huge wheels so that we can go on the beach. But our child might see that that's a loss. So as each one of those losses mount, the relationship might change, and the child might feel a little confused and have what we call anticipatory grief. It is a normal mourning before the actual loss. So before this person dies, we very often, if not always, feel a sense of anticipatory grief, because what it is it's acknowledging what we're losing. And it's a feeling of kind of an impending loss. So this is where those memory boxes, those times together, those videos, taking pictures, doing trips, whatever it is. Those are so critical to help with that anticipatory grief, because then the child can go back to the different stages. They can go back to the different places you visited. They can go back to the art you created. They can read a letter you wrote when you could still write. They could listen to an audio recording in your own voice when you did some voice banking. So thinking about those anticipatory losses and how you can kind of head them off, if you will, by doing things to provide something for that child. So as that normal morning is happening, they're building beautiful memories. And this is an example. I always like to try to bring as many voices of youth into any presentation I do, so that you can really hear them and hear their words. And this is a teenage young woman. She and her sister had a mother with ALS, and they were talking about mom had a speech generating device that was, it sounded like a robot or something to her, right? It wasn't mom's voice. And mom was still very much alive and doing quite well, but she had lost her voice very quickly, very early. So what they're anticipating, that anticipatory grief this family is feeling, is the loss of that voice. So mom is still here and she's still able to do things, but that's that loss. So this is just an example for you to think about what anticipatory grief might look like, and how kids feel about it. And the fact that they play over and over and over a message from their mom on their dad's phone is really powerful, because it's her voice and it's not the communication kind of machine's voice. So grief in children, people ask me this a lot. So does grief look the same in children? Absolutely. Grief is normal. Grief is grief. They respond really well to being with other grieving children. And this is where I can't encourage you enough to get in touch with the Les Turner ALS Foundation, to get in touch with any sort of grief and loss organization around the country. There are camps for kids and families with ALS, but there are camps for kids who have lost someone. And in some ways, it doesn't really matter what the disease is. It matters that they have lost a parent. And they can actually grow from that grief. They can learn through the communication, through the positive interaction, that my parent died, but I was able to talk about it. I was able to be a part of it. I was able to understand what happened, and I was able to move forward and get something out of it. And for kids to know that you can get to the other side, but that grief kind of comes and goes. I tell people all the time, my father died almost 20 years ago, and there are still random moments. It doesn't even feel like it's connected to anything, that he'll pop into my mind, or I'll hear his voice say something, or I'll go somewhere and suddenly it's like, Dad would love that. And I get really choked up. And it's okay, because it's that memory and that enfolding of him on me. And so grief can come and go. It wanes over time, right? But making sure that if kids know the truth and that they understand that it's okay and it's normal, and that they don't need to feel alone, because kids who are grieving often do feel like whatever they're feeling is somehow bad, or nobody else has ever felt that before. And the truth is, you can address it by asking them, how are they feeling? Getting them to talk about it. Are they necessarily grieving the loss of something in particular? And it might sound a little harsh because their parent just died, but what they're grieving really is something that might be happening in the future, that they're grieving the loss of, my dad's not going to walk me down the aisle, Or, my grandma's not going to be there to be a great grandmother to my child, right? Checking in, let them know. Always, always be honest and let them know that you are sad and grieving as well. And don't hesitate to check in with someone who can help you through this grief. And with a lot of people, not everybody, but a lot of people, that is a spiritual or a religious advisor. And don't hesitate to seek out to mental health as well. But acknowledge that your child is going to grieve in their own way. There is no book for grief. There is no book for how to do it. And the way to support your child is to be there, to ask them, to listen, to have that open door, because you know your child best. And you might have a child that says, I'm not talking to anybody. But if you always have an open door policy and you always say, I'm really struggling today, I'm having a difficult grief day, and using the words grief and sadness, and I'm feeling upset, it's all okay. And that there is no one way to grieve, but if you communicate and support, that's the best thing you can do. But people ask me a lot about this idea of complicated grief. And some people talk about it like you're going through pea soup. You're just mired in it and you can't feel or see a way out of the grief, and it affects every part of your life. You're not sleeping, you're not eating, and it's long lasting. And that's the distinction. Whether you're an adult or a child, grief is deep and painful, but over time, grief wanes and you're able to adapt to new normal, and you're able to have moments where you're fine and you're moving forward and they're in the back of your mind and you'll love them forever. But it isn't so overwhelming. If it maintains that overwhelming, ongoing, heightened sense of mourning, that's where we start talking about complicated grief. And in children, complicated grief is displayed by a real loss of interest in anything. And just as a caveat, this is not right after someone dies, right? There's no timeline for grief, which can make complicated grief complicated, right? Hence its name. There's no timeline. But after the initial death, after, maybe a few months, I don't know, you do expect that grief to start waning and be able to talk about them without crying or go through life. But if you see your child, they don't have any interest in the things they're doing, or if they are regressing, if they're starting to act younger than they are. And we see this in our younger children. We see this in children who are really regressing into, they may start wetting the bed again after they haven't done it. They're wanting to start to feel like a baby again after they have felt like a grown-up young child. If they're starting to say things around, they want to go be with their mom or dad who died, right? If they are really getting into an excessive imitation of the person who died and they're avoiding people. The last one, and this is often the one that gets captured the most, is that we see an extreme change in their school performance or avoiding school. This is where you take a step back and get help for your child and get help for you, and talk to the school personnel. Make sure that from the moment the diagnosis happens, when you feel comfortable talking with people about it, you're engaging with your child's school, because those teachers, the school staff, the social workers, they're the ones that are on a daily basis really capturing the mood of your child. And they're the ones that are going to see, he's kind of not acting the same. Something's up. He's different. That the grief has taken hold in a way that it's been 6-8 months and there is no change whatsoever. So for you to think about, how do I address that complicated grief? Get support. Get support from anyone and everyone. And if you are at all worried about your child's physical safety, their mental health, their mental safety, please do not hesitate to immediately get them help. And that might even look like taking them to an emergency room, taking them to an emergency setting where someone can do an immediate assessment about their mental health. Because it might seem like an overreaction, and I get that, but we would so rather overreact when it comes to a deep, complicated grief than kind of assume that it's just normal and let it go. So peer support groups can also be so critical, because then kids see, oh, well, he's doing okay. You know, his dad also died from ALS. Also, kids can help, and adults too, can really help move through complicated, deep, dug in grief if they're doing something to make a difference. And this is where youth can absolutely get involved in advocacy. I have seen this play out so many times, I can't tell you. Kids are really overwhelmed, and then they start going to ALS meetings, research conferences, advocacy meetings. Suddenly they are doing fundraisers, they're doing advocacy. It gives them that sense of purpose. They're still with ALS, but they're with ALS in a very positive way. They're making a difference. So think about how you can have your child be involved in groups, in peer groups, in youth groups, in advocacy groups, whatever they choose. Really encouraging them to express themselves and get support is the most critical piece about dealing with complicated grief. There are very specific ALS resources. This is a book that I wrote for school personnel, and it has a huge section on having school support really help to identify and engage around complicated grief, regardless of what school personnel is. We have several books that are written from interviews that I've conducted from youth, and they're written by developmental stages. Excuse me. The middle one is a graphic novel, and that one is for younger children. The right one, excuse me, is for kind of a tween age. And then the other one is for young adults. And all of them have different issues and struggles. And all of these books hit head on death and dying, grief and loss. We don't mince any words. We say it very directly, and we provide opportunity for kids to read other kids who are dealing with this and understand that they are not alone. So my final thoughts, I think I'm probably close to done with my time, but this truly is the hardest topic. And I hope you walk away from this knowing that there are no final answers, but there are people and organizations and resources to support you. I can't say enough how much I encourage you to seek a trusted source, but don't be afraid to share your feelings with your kids. It's okay to talk about death with children. It is okay to talk about death with children. And it is okay to express yourself with them. And I just want to thank you all for being here, because if there's something I've certainly learned over the years is that I am a constant student of families like yours living with ALS and other really complicated neurological disorders. I've been invited into homes and in families, and I can't express enough how extraordinary that is and how much gratitude I have for you all. So I thank you. Here's my information. Please don't hesitate to send me an email if you have further questions. And I believe that I now need to turn it back over to Nicole.
Hi, Hi, Dr. Kavanaugh. We can stay on together as we're going to address some questions that came in. And I encourage everyone, you should have a Q&A box where you can put your question in, and we will get to those questions if we can, if time allows. Let's see, our first question is, how do you address the question of what happens to the person's body after they die?
Yeah, that's a really good one. So first of all, you need to know what's going to happen to the person's body, right? So this is an often a weirdly complicated question for families because some people want to be cremated and other people want to be buried. So I just want to encourage you all to take a step back and have that discussion and be all on the same page. And it is okay to say what you're going to do with the body. Now, being very careful when you're talking about young children, I would not encourage you to tell a young child that someone is going to be cremated, because then you'll have to explain what that means. And remember, young children are very concrete thinkers. So when you say someone is cremated, that means that they're going to be burned, right? In a very crass, direct way. So then you don't want to introduce a fear of fire or being burned, or I'm going to be burned, right? Even if that person is cremated, oftentimes people are still buried. And it's okay to say that their spirit leaves, but our body stays here, and we're going to protect it, and we're going to put it in the ground, and we're going to go visit as often or as little as we can. Yeah.
Thank you so much, Dr. Kavanaugh. That's really powerful. And I'm glad that you brought up the different different stages and phases of different ages of children and the appropriateness and having these conversations. Another question that we just received is, I have two kids in different age ranges who will lose their grandfather to ALS. Should my husband and I talk to them separately?
So if they're like a hugely disparate age group, I probably would initially do it individually. But if they're closer in age, no, you could absolutely, I would think about it in terms of the younger child. So start the conversation targeting that younger age, concrete, honest. If you get emotional, that's perfectly fine. Be emotional, let them know that they can be emotional too, but frame it in terms of the younger child first. And then if the older child probably will have some more questions, you can go a little more depth with the older child. But if they're too disparate, I would do it two separate ways.
Yeah, that makes sense. Thank you. Another question, Dr. Kavanaugh. I have young children, 3 and 5 years old. How do you find the balance of being honest about the progression of the disease and inducing anxiety at this age group?
Yeah, and I have found that the best way to manage that, and so I'll caveat it by saying, there's no definitive way, and depending on the child, they're going to feel what they feel. So even if you kind of do all the quote unquote right things, you might still induce some kind of fear and anxiety. But a good way to lessen the possibility of that is just to be very concrete. So I remember I had a family where the father very early on lost the use of his arms, and they had very young kids. And, the kids were just like baffled, like, what is going on? And they just said it honestly. Daddy has something, his arms don't work anymore. How can you help me pick up something? How can you help Daddy get around? Make it not a game, but make it normal, make it part of everyday life, and just it is what it is. And that it's not something they're gonna get, and it's not something they did to make happen. Those are two really key things with young kids, because they do internalize things like that.
Absolutely. And, I think there is a common fear of inducing anxiety as parents. And sometimes when I used to work with children and families in this capacity too, Dr. Kavanaugh, I would say there's probably anxiety present already. So you're not inducing, you're really addressing and acknowledging. So thank you for that. Let's see.
Absolutely.
We have one more question so far. Can you tell us whether the stages of grief that we all hear about that adults experience, are those stages similar to how children grieve as well?
Yeah, this is such a great question. And I've been asked this a lot, and I have a perspective on this. So the stages of grief, they're all very real, but I don't want everyone to get kind of stuck, my word, on that you have to go through the stages at a certain time, because what you might find is that someone's way over here and you're like, how did they get to this acceptance? And I'm, really, I'm still deep in anger, right? So
Sure.
kids definitely feel all the things that we associate with the stages, denial, anger, acceptance, all of those things, but they don't necessarily feel them at the stages that we want to impose on either children or adults. And it's okay to feel it in a different order. And kids might feel it in a different order. The honest response is to acknowledge it. How are they feeling? Whatever it is they're feeling, how are they feeling? And how can you get them to communicate and talk about it?
Yeah, that's important. It sounds like it's more of a guide versus these definitive steps that are going to happen. That's really important. I'm just checking to see if we have any additional questions. It looks like we don't. Okay.
Oh, you muted.
My apologies. Dr. Kavanaugh, I want to thank you because I really think you did a beautiful job, and thank you for really normalizing the hard, I like how you call it the hardest topic, and really normalizing that there's really no right or wrong way. We all have to just take the next step and have those conversations, because it sounds like it's an opportunity for the person that's the parent, the child, or the grandparent and the grandchild, both of that relationship to really become more solid, honest, authentic, and really helping each other process all of those different feelings. So thank you so much.
Oh, it's my pleasure and it's my honor. It absolutely is. I can't thank you enough for inviting me. Absolutely.
We feel honored to have you, and we appreciate it so much. Thank you again.
All right. You take care. Thank you so much, everybody.
Bye-bye, Dr. Kavanaugh. Okay. So I wanted to invite all of you to join us next month. We are going to be, we're lucky enough to have Dr. Coleman with us next month to talk about respiratory care and ALS around our ALS awareness campaign, Take a Breath. I'll tell you a little bit about that in a minute, but this webinar is going to be happening on Thursday, May 20th at 12 o'clock Central Standard Time. And then our next, I'd like to tell you a little bit more about our ALS Awareness Month. That's recognized globally each May, and it really is an opportunity to share information with your community about ALS and really the unmatched work that we do here at the Les Turner ALS Foundation. We invite you, your passion, and your commitment to a cure to join us as we spread the message of hope and help for people living with ALS. Above all, ALS Awareness Month is a way for community members to rally around people living with ALS and their families and spread awareness. So please join us and get involved. And we also invite you to join our celebration of life to remember your loved ones lost to ALS. That'll be happening on Facebook Live on June 12th, 2021. And then lastly, please save the date for our 11th annual Les Turner Symposium on ALS happening November 8th, 2021. The symposium features presentations from leading ALS clinicians and researchers, including members of our Lois and Salya ALS Clinic at our Les Turner ALS Center at Northwestern Medicine. And lastly, a special thank you to Dr. Kavanaugh for sharing her knowledge, her expertise, and really her heart and soul with us today. And thank you to the rest of to all the participants for being here today. And we look forward to seeing you at our next webinar next month. But before we close, I invite you to take a moment and fill out our survey that you will receive at the conclusion of this webinar, because your feedback is important to us. Thank you, and we hope to see you again next month.